my stout friend and myself. Hi. Hi! Welcome to the show. You know, a couple of years ago, we were the first to introduce you to a new and beautiful movie star, Bo Derek. We did it right here in this set. And tonight, you're going to meet the newest sex symbol of the silver screen. She's been described as the woman of the 80s. Cindy Pickett will be here. And fellas, you're going to delight in meeting her. I'll tell you that. I talked with Cindy this afternoon for about an hour, and I couldn't take my eyes off her voice. And we're going to take you inside a real operating theater at Melbourne's Alfred Hospital tonight. And you're going to meet some of the staff, and they're going to show you how they go about preparing for and performing an operation. Now, most of us never get in there unless we're having one done, and I think you'll find it really interesting. You're also going to meet Peter Doyle, the owner of the famous Doyle Seafood Restaurants in Sydney. And he's going to show us what goes into the running of such a successful business. I love going out to dinner. Do you like going out to dinner? I really like doing it. I found a great restaurant last night. It's a Japanese-Australian restaurant. It's called Nip and Tucker. And should I let them work on it or just keep going? I don't know. Bert has some new and unusual products for us to look at. Debbie Byrne will be here to sing for us tonight as well. And so will Janine Reed with the ballet. They're back there right now. You put your hands together and we'll have a lovely show for you. Melbourne has one of the most modern operating theater complexes in the world. Now, most of us only see inside an operating theater when we enter as patients. Now, tonight, with the cooperation of the board and staff of the Alfred Hospital, we're going to meet a surgical team who have set up a theater especially for us to have a look at. Now, we're now going to cross live to Melbourne's Alfred Hospital, where Kevin Arnett is waiting for us. Say hello to Kevin Arnett, will you? Yeah, hey!
Thank you very much indeed, Dan. Good evening. I'm not going to be dressing like this normally on the show.
Hang on. They were still clapping. I didn't hear what you said.
I said I'm not going to dress like this normally. This is not my street gear, but I'm not dressed like this as a gimmick.
Me, Kevin.
No, I'm not dressed like this as a gimmick. Actually, I'm dressed like this because this is a totally isolated area, and very few people ever get to come in here. It's the operating theatre complex of the Alfred, and it's like a sort of a city within a city. And because very few people get in here but the staff or as patients, what we want to do tonight with the Don Lane show is to show you and the viewers just exactly what takes place in a modern operating theatre. But before I came in here tonight, this is what I had to do to get in here. Wait till you see this now. Now there we come towards the operating theatre. You see, what I have to do is it's total security here, and you have to identify yourself first of all. Then when they know who you are, they open the door. Now you sit down here. This is sort of like the Iron Curtain of the hospital. You have to put these overshoes on because your shoes, of course, contain a lot of bacteria. You put the overshoes on so that you'll take away the bacteria. It won't be put onto the hospital floor. Once you've got the overshoes on, then you walk into a change room. I didn't let you see this because my knee's not the best, but you come out in this gear, which has all been freshly laundered, and so this is so you don't bring bacteria into the hospital. You walk over that sticky area that I just walked over then, and this is to make sure that there is finally no bacteria at all on the overshoes. And here I am, of course, like this and dressed like that.
Do doctors, do they all wear regular shoes when they go in?
You wear regular shoes, Don, but you put the overshoes over the top of those just to make sure that you don't have any bacteria that you put on the floors of the actual operating theatre area, because this, as I say, is quite isolated. But what I'd like to do now, I'd like to introduce our tour guide for the evening, and for ethical reasons we're not mentioning names tonight, so can I introduce to you the sister in charge of theatres. Sister, I'd like you to meet Don Lane.
Hello, sister. Give sister a greeting and say hello to me, please. Sister, that looks like a pretty large complex to me. How many people work in there?
Well, on a busy day, up to perhaps 150. Mm-hmm. It's a little less other times.
That's not a real patient, is it?
That is a pretend patient, a very good pretend patient.
Thank you. You had me worried there for a minute.
The patient was worried too.
Yes. How many operating theatres are there in that complex? I assume there's more than one.
We have 14 of them. There are 3 groups of 4 and a pair. Mm-hmm. And they have ancillary rooms, supply areas, cleaning up rooms, and the usual offices.
There's even a blood bank hoist I see just to my left here at the moment. And now we're coming towards the actual operating theatre rooms, Don. This is where the patient goes in. Now there's
Kevin,
a special process here.
I have to ask you to put on a mask when you come in here, please.
Right, now why do we put these masks on before we go into the operating theatre system?
So that any bacteria we have in our nose and throat won't contaminate the sterile trolleys in
here. And you really can't get in here unless you put these masks on first, I understand.
We won't let you in here without a mask.
How many operations take place in here, do you think?
somewhere between 20 and 50 a day, averaging 40 a day. We did about 10,800 last year.
Is that round the clock, sister?
Yes, but most of them done during the morning hours.
During the morning.
Well, let's go to the actual operating theatre complex. Now, this is where you're going to see some of the operating theatres. Now, let's just explain this to you, Don.
Well, the patients have travelled through the centre of this complex, and the lady you saw coming in would be held in a small room here. The nurse stays with her and checks her, makes sure that she knows what her operation is to be and has consented to this, that her x-rays and investigation reports are available. And perhaps the doctor and the anaesthetist might see her before she comes into the operating theatre.
Now, what we're seeing, Don, now is the washing area. This is the actual wash area before they go into the operating theatre.
But Kevin, all of those little rooms off of that with the tables on it, each one of those is an operating...
Yes, each one's an operating theatre. When you're here in the morning, I've been allowed in here to watch some operations. It's absolutely fantastic to see the care that's taken of the people, the relationship the nurses have with the people when they bring them in, and afterwards when you see them in the recovery room. And in the morning particularly, it's just so busy in here, it's unbelievable.
How many are in that complex you're in now? In that area, I mean.
There are actually 4 in here, Don. There's 4 in every complex.
4,
and
I see.
What we're going to do now, we just want to show you to an operating theatre. We're going to go in here in a moment, but as you see, there's no operation taking place. We didn't think that was necessary to do that tonight. We just want to explain really what goes on in an operating theatre for an average operation. But what we did do, we brought a film team in here this morning. We want to show basically that team doing something in the operating theatre this morning. Here's a little bit of film we shot for you.
Oh, wow.
So this is just to give you an idea of what was taking place this morning. There's an operation going on, and you see basically the same people that you're going to meet in just a moment. They're always so busy in here, but the teamwork is something that has impressed me enormously. As I say, I've seen quite a few operations. In fact, I think I could almost do a gallbladder operation myself now. I've seen so many. And this does sort of take away the anxiety I think a lot of patients would feel when you get a chance to see what really does take place in an operating theatre. And everything, of course, today is so modern. I mean, when you look back 100 years, it's unbelievable the progress we've made in the last 100 years or so with anaesthetics and so on.
Yes,
and and now we've come to the moment I think everyone's really been waiting for, and this is the most exciting moment of this evening. We want to actually take you into an operating theatre to meet some of the people and to see all the things that take place in here, to find out what each person does and to talk to them. And this is really a most modern operating theatre, one of the most modern in Australia. And what I'd like to do now is to introduce to you the surgeon for the evening, Doctor, who is just here with the light on as we come around with the camera. Doctor, I'd like you to meet Don Lane.
Good evening, Doctor. How are you?
How are you, Don?
I'm very well, thank you. I thank you for providing all this, helping us with all this. This is really interesting. What are you set up for there at the moment?
Yeah, the operation that we're simulating is as for a cholecystectomy.
A what?
And that is a removal of the gallbladder.
Ah.
The patient is a volunteer patient. She's not going to be carved.
Yeah.
She hopes.
Yes. So can you tell me who those people are there?
Yes. First of all, the theatre technician, whose responsibility is the initial care of the patient when the patient arrives on the floor. And he's responsible for the transport of the patient to the operating theatre and the positioning of the patient on the table, and for the placing of the electrosurgical earth plate on the patient so as there are no burns from the electrosurgery.
Electrosurgical earth plates?
Yeah.
I don't know what those are.
And she would not allow me to put it under her because it's wet and it's cold and it's awful.
Oh, right, yes, I see. Right, okay.
And the next is the anaesthetist, who's responsible for the safe anaesthesia and the adequate anaesthesia for the conduct of the operation.
I think one of the questions that I found a lot of patients would like to know, Doctor, is patients say, what would happen if I woke up during the anaesthetic, during the operation?
Well, this has been known to occur. Fortunately, the anaesthetic that we use, nitrous oxide, causes loss of pain before it causes loss of consciousness. And people who do suffer this very unfortunate occurrence complain of hearing voices, but fortunately of feeling no pain.
I think that's the fear of most people, that they will feel pain. And do you have any other anxiety feelings passed on to you by patients about anaesthetics? I think it's the anaesthetic that seems to worry people most of all, Doctor.
I think patients are worried, some patients are very worried about losing consciousness and losing control of their bodies. Yes, that's true.
And I think also a loss of dignity is feared by people.
Yes, we do everything we can to preserve it, but people don't know what's going to happen to them when they're unconscious, and naturally they're afraid.
Do people react different ways to when they are anesthetized? Do some people react differently to the things?
They behave in different ways when an operation is approaching. Some patients are very nervous and other patients are inappropriately happy, it would seem. But I think all patients are uptight inside.
Do patients swear under the anaesthetic? I think a lot of people are afraid that they might swear or make fools of themselves under the anaesthetic. Does that happen?
That is very uncommon indeed. In fact, it hardly ever occurs during induction because we start an anaesthetic with an intravenous drug, thiopentone, and that puts a patient out to sleep within the seconds.
Oh, I see. So there's no time.
There's no time. It does occur occasionally during emergence, but nothing memorable. I can never remember a patient saying as they come out of an anaesthetic.
And what I'd like to do now is, perhaps if we can go back to the surgeon, to just have a general look around the equipment in the operating theatre.
Can we meet those other people? I just want to know who those other people are there.
Right.
The next person is the anaesthetic nurse who's responsible for assisting the anaesthetist, and it's her duty to go out and get any extra drugs or anything that isn't immediately available within the operating theatre.
Right.
The next person is the first assistant, whose duty is to help me retract skin edges, do anything which can aid the operation, holding retractors, so as you can get to the site of the operation.
Yes.
In most operations in the hospital such as this, we would have a second assistant whose duties are very similar, to assist the surgeon to make the ideal exposure for the conduct of the operation.
Does this same team work together all the time, Doctor?
This is a team that would be constant at this stage for 3 months.
I see. Okay.
The next person is the circulating sister, whose job it is to check in with the scrub sister the instruments, packs, sponges, etc., and also to get any extra equipment, sutures, etc., for the conduct of the operation. And last of all, probably of equal importance to anybody else, is the instrument or scrub sister, whose duty it is to hand up the instruments in a sequence which is rational to the operation, in a safe way, so as people do not get injured with the passing of these instruments.
Well, hello, sister. Doctor, now you've talked about the instruments. Now, we've always seen, you know, whenever they do it in movies and things, you hear clamp and suture and all those things. You have all those instruments there laid out. Can you show us those?
Yes, indeed. This is a scalpel, which is passed, as you noticed, in a very safe way, so as the risk of cutting myself with it is minimal, and the risk of cutting herself as she passed it is nil. Mm-hmm. It is an extremely sharp blade. It may have to be replaced several times during an operation, and is discarded at the end. It is only used for one patient or only for one part of an operation. Mm. Of course, that, when it's used, produces bleeding. And the next thing is a hemostat, or so-called artery forceps, which is used to pick up an artery or bleeding vessel, to be tied by a suture, such as a linen thread, or with the electrosurgical unit, which will, on touching the forceps, will burn or coagulate the blood. This electrosurgical unit, by pushing the button in a different way, will actually cut tissue, just like a scalpel, with an electrical current.
Oh.
Forceps are used for either picking up bleeding vessels or for holding skin edges or tissue to allow easy dissection.
They look like very large tweezers.
Well, they're very fine, actually. There are much larger ones, such as those, which might be suitable for thicker hides, I think.
Right.
Then you have scissors. These are heavy-duty scissors for cutting of heavy tissue, or finer dissecting scissors, which for delicate part of dissections around blood vessels, vital organs, etc. And of course, to have access to the area, one must have retractors, a superficial retractor for the superficial layers, deeper retractors for cavity work, and this is the duty of the assistants, to hold these retractors in such a way that you can operate clearly with direct vision.
And that's the instruments you have laid out for this operation?
Well, yes, of course. If over here on the side is a tray full of instruments which would be handed up as required by the instrument sister if they are requested, or if she feels that they're going to be needed, she would have them available and just pass them directly to me.
What is that? It looks like what is that on your head?
That is a headlamp. Above me, there are two very modern operating theatre lights.
Right.
These are adjustable. They have sterile handles which can be fitted to the light and allow maneuverability of the light to give illumination wherever we need.
Are they fixed so they don't glare on you or anything?
They don't glare so much, except you do get some reflection back from the wound itself because of the brilliance.
Right.
But when you put your head across in front of the light, this does create a shadow, and this is where the headlight is valuable, in that it gives an extra light into the wound so as there is no dark spot where you're working.
Right. Now, how many operations would you perform in a day?
In this institution, anything up to 7. Usually there wouldn't be that many, usually 3 or 4, and of course it's not how many operations, it's the length of the operation and the complexity of the operation which is the important feature.
Of course, it's not always serious in here, Don, I found out either. I think the doctor has at least one amusing incident which occurred quite recently.
Now, this is relevant to a patient who was brought in. Patients are supposed to have ultimate faith in their surgeons, but this patient, on being placed on the operating theatre table, immediately got off, knelt on the floor and said, "Please God, guide the hand of my surgeon."
Well, it's nice to know you had everybody on your side.
Any help is, you know, appreciated.
Well, I certainly appreciate you allowing us to come in and showing us all of this. It's been a fascinating, I don't know how long this has taken. The time has just flown. Oh, I see, that's the negatives.
We have available X-ray viewing boxes, extra X-ray equipment if we need the X-rays during the procedure. Beside it, over there is a control panel for lighting, etc. This is a modern operating theatre, and we're very lucky to have it.
And we're also, I think, Don, very lucky to have been able to come in here, and at this point I would really like to thank the Board of Management of the Alfred Hospital, the doctors, the surgeons, the sisters, the nurses and the public relations people. I think we've all had a bit of a fear of hospitals.